Okay, let's unpack this. Today, we're diving into a book that genuinely shifted my perspective on global health and really the connections between illness and, well, social justice.
Ah, you're talking about Mountains Beyond Mountains. Tracy Kidder's book on Paul Farmer.
Exactly. The Pulitzer winner. It's quite something.
It really is. And what's so remarkable, I think, isn't just the medical side, the details about TB and such. It's how Kidder brilliantly gets at the deeper societal stuff behind the illness.
Yeah.
So our mission today for this deep dive is really to pull out those key lessons, show you why this doctor's fight against, well, bacterium became this huge battle for human rights.
And the book really introduces us to Dr. Paul Farmer, right? A physician who he championed this idea that seems radical but is also incredibly simple. That diseases like tuberculosis aren't just biological things happening in a body. He argued quite powerfully that they're deeply, deeply intertwined with these big systemic issues.
Right. Challenging the whole way we usually think about global health crises.
Totally. It's not just about the Mycobacterium tuberculosis germ itself, is it? It's about the conditions that let it run wild.
That's exactly it.
Yeah.
And if we connect that to the bigger picture, Kidder does a masterful job illustrating Farmer's idea of structural violence.
Structural violence, yeah.
He shows how poverty, weak public health systems, political neglect, even lack of access to basics like clean water or decent food, these aren't just correlated with disease.
They're drivers.
Direct drivers. Farmers' work, especially in places like Haiti, really hammered this home. You can't just treat the patient's infection effectively,
Right.
You also have to tackle the socioeconomic stuff, the context, making sure people have food, can actually get to the clinic, live somewhere safe. It's about comprehensive care, real comprehensive care.
And Kidder brings us home with these incredibly human stories, doesn't he? Like, there's that example, so poignant, of patients like Henry in Haiti. Yeah, suffering from drug-resistant TB in this really neglected area. And Henry's story just starkly shows how, when someone doesn't have consistent treatment or food or even just a basic roof,
A treatable disease becomes.
it becomes a death sentence.
Yeah.
And then it spreads. It infects whole communities. It's just this stark reminder that disease isn't in a vacuum. It absolutely flourishes where systems fail people.
Which then raises that critical question, doesn't it? The one
Yeah.
Paul Farmer basically dedicated his life to asking.
Yeah.
Is TB just a medical problem? Or is it actually fundamentally a systemic failure? And if it is, then fighting it becomes a fight for social justice. And Kidder really brings Farmer's relentless pursuit of that question to life. It pushes way beyond the usual hospital walls or just finding the next drug.
Right. It's a bigger than that.
Farmer genuinely believed, I think, that the best medicine, especially for the poor, was actually social justice itself.
Exactly. And that's the book's big lesson, isn't it? It really compels us, you, the listener, everyone, to see diseases not just as these isolated clinical cases you read about.
It is symptoms.
Symptoms of these much broader societal problems. Inequities. It forces you to look past the clinic and ask, okay, what decisions, what lack of resources are actually enabling all this suffering?
Yeah, what social choices are weakening people, weakening whole societies, letting illness take root. So ultimately, the book's takeaway, it's profound, but it's also pretty clear. To truly get rid of diseases, especially these diseases of poverty like TB,
It takes more than medicine.
way more. It demands this unyielding commitment to social and economic justice, building systems where good health is actually treated as a right for everyone, not, a privilege for some.
So thinking about this, what does it all mean for you listening? Maybe next time you hear about some persistent health crisis somewhere in the world.
Or even nearby.
Or even nearby, yeah. Consider this insight from Kidder and Farmer. Ask, what underlying social issues, what lack of justice might actually be fueling the spread? What other diseases are we just, fighting symptom by symptom?
When the real fight, the deeper fight,
Yeah.
is actually about dignity, about equity.
Exactly. Something to really think about.